The greatest good of a health insurance program is to proactively connect the at-risk patient with the medical provider or program that gives them the best chance of getting better. That's where we need to be spending our time, is figuring out how to do that.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm Jimmy Markham, Communications Manager for the Jindal School. Today's show is part one of a two-part series with Dr. Britt Berrett and Bishop. Bishop is president of Holmes Murphy, a consulting firm that connects employers with cost-effective, custom-built health insurance plans. Today, Britt and Den will be discussing ways to get a handle on spiraling healthcare costs from the perspective of the healthcare insurance industry. Let's listen to part one now.
Well, we're delighted to have Den Bishop with us. He's the president of Holmes Murphy and has a unique perspective on the business of healthcare. Den, welcome to the show, and we're delighted to have you with us.
Thank you very much.
You know, tell us a little bit about your background, how long you've been in the industry, what got you there, and what keeps you there. You've got decades of healthcare experience. So tell us a little bit about that.
Yeah, I kind of found my way into the business side of healthcare out of school at SMU and started with an insurance company, Aetna. Spent about 8 years there, then to a national consulting firm, and then went to Holmes Murphy 21 years ago. So I've got 3 decades worth of experience in this thing at this point.
Wow. And what keeps you at Holmes Murphy? It's got to be an awesome organization.
Well, it's, one of the things for me is it's an employee-owned company, and that's important for me. I don't like taking direction very well, so I'm better off if I can be part of the group trying to set that direction. But it's just been a great entrepreneurial place. I will sometimes say and talk to new hires that we have in that I love what I do and I love the people I get to do it with. And not a lot of people get to say that. So I consider myself very fortunate to be at Holmes Murphy.
You're filled with possibilities, right? You're like the possibility thinker, right? And so how do in an industry in a time when we have some real serious issues, how does that benefit Holmes Murphy? I mean, this possibility thinking.
Yeah, and take that a different place. I was in a seminar in San Diego back to your roots a little bit on that a few years ago with Pfizer. And
Sure.
So I was the lone insurance broker guy in the room, along with these people who all had significant experience and a lot of letters after their name and talking about how they were changing the world in healthcare. And it kind of got around to me as we were doing introductions. And I told them, I said, well, I'm Den Bishop from Holmes Murphy, and I sell hope. And the entire room just started dying laughing. And I said, that's what employers want in today's healthcare system. They're paying the bill. They're making, at times, can be life and death decisions. They want information, but they want a sense of hope that they can do better and have better. And I think that's a big part of maybe what my role is and our role in healthcare is trying to guide people to their place of hope.
So let's talk about that then. So we have a large number of employers that cover the insurance for their employees, and they are experiencing year after year growth, double-digit growth, complexity. Geez, you can't even get the pricing for some procedures from the provider. So I'm not saying it's hopeless, but tell me what hope you're trying to instill in the employers. What stories are you telling?
Well, I define the ecosystem of the employer-sponsored healthcare space by 3 things. Okay. That we have the most complicated consumer industry in the world, we have the highest cost healthcare system in the economically developed world, and we have amongst the least healthy populations in the world. As an employer, congratulations. Those are the cards you have been dealt. So to deal with those 3 problems, complexity, cost, and health, you have to be very specific. What can we do to reduce complexity for an employer or for the plan participant? I don't think we should be making this whole thing harder. I think we should be reducing some of the complexity at a consumer level. What can we do to get better value? And ultimately, as an employer, what can you do to find cancer faster, to connect people with the right doctors and the right programs, And employers who take that aspirational view, I find, spend less money.
So, yeah, very hopeful. Doable?
I don't want to disappoint you on my hope.
Well, what did we say? Hope is not a strategy. So let's talk a little bit about that. The complexity is overwhelming. These employees, I mean, you ask anyone, what does your healthcare plan provide? They can't even tell you. They have no clue. And then when they're provided services, the best way they can monitor it is by the number of bills they get in the mail. We're going through that ourselves. And so you're suggesting reducing the chaos and the complexity for the employee. Is that what you're suggesting? Will that drive down costs?
I don't believe that we can solve the cost problem when we increase complexity. And so not to go political on things.
Please, let's go there.
But an idea that says it's the consumer's responsibility to navigate this on their own and figure it out and be a better consumer. Mm-hmm. Well, if you are sitting in a gown with your rear end exposed, being told you have some 5-syllable condition you didn't know existed 10 minutes before, that is not a great moment to be a consumer. You're a patient at that point. The insurance component should take care of navigating the pricing, the complexity of all of that should be the least of your concerns. And I think we've gotten it backwards in recent years as we've increased the cost to consumers. I think we've made it harder, and maybe that's why we're not saving the money we should save. They don't know where to go.
No, that's an interesting perspective, and I really will agree with you. We used to, unfortunately, note that when a person was diagnosed with some type of disease, when they enter a hospital, their IQ drops 50 points. They just roll over and say, okay, whatever you want me to do, doctor. Not so much nationally, but most definitely the Texans have a huge amount of respect and affinity towards their care provider, so they'll basically do what they're directed to do. You intend to insert yourself into that effort?
Absolutely not. I don't believe that it is the employer's role. I don't believe it is the insurance role to get in between patient and provider. I think it's the employer's role and the insurance role to give the consumer, the patient, the information so they can make the best choice to get to the best quality care that's available.
So data
drives it. We can figure out where the best care is delivered for certain procedures and get people to those places. And that's my great, I guess, back to hope. That's what I hope. I will use my dad as an example.
Okay.
So my dad lives in Wichita Falls, and nothing against healthcare in Wichita Falls, but he needed hip replacement. I had data, because I'm in the insurance space, where the data told me that the best quality was, and that best quality was one of the hospital systems here in North Texas. And so when he needed his care, he called, and I got in there, I gave him the data. He went, he had a fabulous outcome for that. It was so good, he's had his other hip done at the same facility. But had he not had access to me and the information that I had, then he would have been trying to figure out whether it's better to have a posterior or anterior procedure on his hip and navigate a language that he didn't even know. But because I'm in that insurance world, I could help navigate that for him. I wish everybody had access to that level of quality information.
And so you advocate that the consumer is entitled to that information.
I believe that the consumer is entitled to that just the way they're entitled to quality information in every other area as a consumer.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
pricing transparency has been a conversation, not the quality conversation, but just even the pricing. Are you finding any inroads with providers unwilling to share their pricing information with the consumer?
Wow, that's a big question. So there are technology platforms available that can get to that information that insurance companies will then make available that are there.
Right.
There are concierge services to that. But the baseline price is so hard for the consumer to get to. Again, if you think about the coding structure and what if something doesn't go as expected,
right.
It's there. Or what if the radiologist who read the data for me was out of network, even though my physician was in network? I just think the system is still in a place where it is very, very difficult for a consumer to really be a consumer. That's why I believe the insurance component of that should relieve them of that pressure. And in an ideal world, I believe that the insurance program should give the patient a guaranteed cost and that the insurance should take the variability in that because the patient really doesn't have a way of knowing. I was doing some work for the city of Mesquite years ago, and we were working in the firefighters representative on the insurance committee was going to have knee surgery. And so he wrote in Sharpie on his leg, Cigna doctors only, on his own leg.
I'm
before
with you.
He went, and then he got a bill from a non-network physician who was somewhere, while he was passed out from having his surgery. And he was irate. He said, I wrote on my leg, Cigna doctors only. And yet it wasn't there. So it's tough to be a consumer.
So you think the insurance companies can insert themselves into that dialogue to assure that the individual knows exactly what they're costing, what their obligation will be, but the risk is borne by the insurance company. Is that your thinking?
In a consumer world, why should the consumer have all the variability when they have been knocked out and they have no control over that? So we're putting the responsibility on a party in a financial transaction who is not equipped to be making financial decisions at that moment.
Totally agree. But, it's a big obligation that an insurance company would assume. I mean, let's look at your father. I mean, that's a perfect example. I mean, he doesn't even know what quality is. The best he can ascertain is what the doctor referred him to, but that's, subject to personal opinions. It has nothing to do with measurable quality criteria.
I do think it's possible for employers who are willing to get innovative and willing to think about how something should work. There are 61% of the Americans who have insurance through their employer are in self-funded plans. So the insurance company is really just an administrator.
Yeah, facilitator of the funding.
The dollars are coming right out of that employer's bank account. So one of my customers, they're owned by, they're a Berkshire Hathaway company. So they're a part of a really big corporation. They're a large corporation. So they looked at that, and they've got a lot of hourly workers. And so we implemented a plan 2 years ago that's all copays. So anytime a patient needs a procedure, they'll look on the schedule and then say, well, that outpatient procedure is $400. That's my cost as a patient. This one is $800. So we have gotten very structured on that. And it was really around that idea of let the patient know what they're going to pay. Let the insurance component take the price variability up or down from there. They have to stay in network, and they do. It's an in-network only plan that's there, but the patient knows what they're going to pay when they go to the hospital, and there is no risk from a patient standpoint. They will know exactly what that outpatient surgery cost them, but they had a forward-thinking employer who really wanted to take their employees out of the middle. And it's one of three options, and they've got about 20% of their employees have chosen that option. It's a little more expensive per paycheck, but they know exactly what they're going to pay.
Yeah, that is a dilemma. I mean, it's a huge dilemma, and the industry isn't responding to the consumer's discomfort at all. And I find that intriguing, having been in the provider world for decades. It really is becoming even more complex. What's the response of the market to what you're proposing, this hope?
I think the market is still looking for something that is implementable. The world in which employers live today is inundated with one of my friends from Blue Cross Blue Shield refers to it as the ankle biters. And the ankle biters are all these small, innovative companies that keep trying to come in and sell to their customers, and Blue Cross Blue Shield's trying to swat them away like flies. Say, we want to control all of this. Employers struggle a little bit today in that they have to make a decision. Do they go with the efficient answer that's a Blue Cross, a United, a Cigna, and Aetna, or do they start to try to add different companies for different components of this, and then that adds more complexity?
Yeah.
So I think they're really waiting until the market can evolve with some package solution that's there, and there are a host of entities kind of racing towards that, what we're referring to as alternative health plans. Is there going to be something different than Blue Cross, United, Cigna, Aetna that's there? And I think that there will be. It's just a matter of what it looks like. It's too much. At 18% of GDP,
yeah,
it's too much of the economy to just let it sit there with four major national players. And I call it Blue Cross. Blue Cross is an association that's there. But I believe that innovation will come to the space. It's just a matter of what it's going to look like.
Interesting. I think we all share that frustration, and the rising healthcare costs and the amount that's being pulled out of a paycheck is unstoppable. And as exciting it is as we look at new technology, and I remember sitting at a table with THR and considering the investment of a proton beam center, and there isn't one in Europe, or that maybe they're definitely in the UK, but we've got one in Oklahoma, we've got one here in Dallas. Gosh, the next thing you know, there'll be one in the local mini mall. But it's $100 million investment, and the technology is indisputable, but it's over $100 million. So these costs continue to grow. There's no stopping them. And you're suggesting that there's hope because we will create some type of simplicity. We would reduce the chaos. And Holmes Murphy would play a role in that, is basically what you're saying.
If we can't play a role, we at least want to be a passenger on the train.
Got it.
I think simplicity, until we simplify the system, it's too difficult to get the cost out of the system. Complexity hides cost problems.
Yeah, so true.
Talk about access to care, because I do think in this country, I will often speak on the subject of healthcare and healthcare policy and those kinds of things. And people will go of the opinion that we have this bad healthcare delivery system in the United States because our life expectancy isn't better than other economically developed countries. And I think that's absolutely false. The data is the data. But if you look closer at the data, we have the best healthcare system in the world. If you're diagnosed with cancer, you have a better chance of living longer in the United States than anywhere else in the world. It's just a very complicated, costly system, and that's what we need to get out. I don't blame the healthcare system for our mediocre life expectancy. Those are choices that we make. The healthcare system actually keeps us around in spite of some of the choices that we make. And access is something that's very important. I had a dachshund named Max. I loved Max. Max was a good dog, but Max, as many dachshunds do, he had a bad back. And I scooped him up one day. He wasn't moving, and I took him to the vet and carried him in. And the vet looks at Max and says, "Hey, we need to get an MRI." And I'm thinking, well, okay, Max.
I don't love that dog that much.
Yeah, Max is an 11-year-old dachshund at this point. I don't know how many. He had a few years left that was there. So, but it was my daughter's dog, so I scooped Max up and we go, okay, let's go. And we had to take him over to another facility. Thankfully, the vet didn't have an MRI machine in his office, but it was only about a 5-minute drive. I immediately got Max in on a Saturday, and he immediately had an MRI and had the results almost immediately thereafter. My dachshund Max had access to better healthcare technology than anybody anywhere in the world other than the United States of America. And so I think we've got this expectation that great quality technology and great quality healthcare is going to be immediately available whenever we want it. And that's really expensive.
You know, I grew up in Canada, in Vancouver, and I lived in South America for several years. And I couldn't agree with you more. We're so critical of our system. And to be sure, there's issues that need to be resolved. But we have an amazing healthcare delivery system. Some of it I attribute to, I call it the Grey's Anatomy syndrome, where we can solve everything and cure any ailment, that everyone will be happy, when that's just not the case, that life is the way life is. But the complexity of the healthcare delivery system can be overwhelming for those who try to navigate it. And so, Holmes Murphy, you're suggesting let's reduce the complexity. Let's make it simpler. Let's make it more easily navigatable for the individual and for the organization. That's admirable. I mean, it really is. It's aligned with what UTD's message is, the business of healthcare. We're asserting that smart business practices need to be developed so that the clinicians can do clinical things and that the processes and systems are orchestrated magnificently. And that's probably where our biggest shortcoming is.
Well, along that path, what we'll often ask customers is, what's the greatest good of a health insurance program? And they'll look at us and think, that's a strange question I've never heard. Is it covers all the costs? And we go, think better than that. The greatest good of a health insurance program is to proactively connect the at-risk patient with the medical provider or program that gives them the best chance of getting better. That's where we need to be spending our time, is figuring out how to do that.
That concludes part 1 of Dr. Britt Berrett's discussion with Den Bishop of Holmes Murphy. Join us next time for part 2, where Britt and Den will roll up their sleeves and delve into the complicated beasts that are Medicare and Medicaid. Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode notes, links, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Centers and Institutes tab on the navigation menu. Also, we want to hear from you. If you would like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z, and let us know how we're doing. I'm Jimmy Markham, Communications Manager for the Jindal School and the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.